Hi everyone, my name is Kayla Keeney, and this week I am doing my presentation on iron deficiency anemia. The disease process is in the body, the red blood cells lack iron. The pathophysiology is that there are red blood cells that help to transport oxygen throughout the body. And when the iron decreases, there's complications. It's important for the organs to receive the oxygen to keep everything flowing. The risk factors are chronic blood loss. Blood is being taken away from the body, which allows a risk of iron coming out as well. Poor iron intake. Iron can be taken in with the food that we're taking, such as vegetables and meat. Vegetarians are at risk as well. Liver disease causes a poor intake of iron. Menstrual periods, you are losing blood, and of course, if you're losing blood, you're probably losing iron as well. Pregnant women are at risk. They are giving all of their blood and the iron to the child that they are growing, and also they're at risk after childbirth, delivering the child due to the blood loss. And medications such as NSAIDs can cause a risk of bleeding. On this diagram, by learning chemistry in 2023, they show what a normal blood looks like in anemia with the platelets, white blood cells, and red blood cells. Some of the symptoms that the patient may experience is pale skin, fatigue, weakness, cold throughout the body, increased heart rate, tachycardia, change in their menstrual period, fainting, muscle aches, shortness of breath, hair loss, and headaches. The diagnostic testing would be doing lab work, such as getting your hemoglobin and hematocrit levels, as well as the iron levels. Endoscopy or colonoscopy, especially if the patient's been taking NSAIDs for a while or has history of GI bleeds. This is a great way to see where the source of the blood is going. A stool sample, this can show if the patient has blood in their stool, and also doing an ultrasound just to see if they can figure out if there is a bleed somewhere in the body. And these are my references I used this week. And thank you so much for listening, and I hope you learned something. Thank you.